So passing rates.
Passing rates.
AFK passing rates?
AFK, yeah, for AFK, passing
So
rates.
results came out.
Yes.
We've been waiting it for a while. Took a long time this time. And how do you feel about the results we had?
I feel great. How do you feel?
I feel good too. Yes,
Yeah.
we had a good outcome.
Yeah.
And the people we predicted to pass, we could say almost 93% of those people passed. But it comes down to how you calculate also the passing rate.
Yeah, that's true. That's true. Like, how many people did we have on this cycle that went to the exam? Like around 20? No, 40.
More than that.
40.
Maybe 40. We had and we could say maybe if you look at it, all the total students you're saying.
Yeah.
Like if we count the total number of students that took the course and went to the exam.
I think it was around like 40.
Yeah, and half of them passed. So
Yeah.
some people look at that and go, okay, is that the passing rate? Half the students.
People never know, like, what is the passing rate? Like, from all your students, like 93% passed?
Yes, and I'm
Yes
pretty
and
sure
no.
in consoles that's like the most
Yes.
frequently asked question.
It is, yeah. People want to know. They just
Yeah.
want to know, like, what's like, how good is your institute? They base their assumptions, I guess, like on your institute, like based on the passing rate.
Yeah, I never liked the concept of it because it always gives like this idea that it's a cookie cutter, like whatever happened that cycle is going to replicate 100% this cycle.
Yeah.
And that's never true for really anything. Like you can't, because the questions in the exam could be different. The students you get could be different, right?
And it varies from person to person. So, like, I honestly never looked at passing rate.
What did you look for? Like when you looked at, what did you say?
I looked for a course that was entirely online.
Yeah, and
I needed a course, like I needed the flexibility. I have 3 kids, so I needed a flexible course for my schedule,
and we do the AFK
and obviously
course
like
online.
a course that had the qualifications, everything, like good content.
So it's like the user experience, the student experience. They're happy with it.
Reviews. I
Reviews.
looked at reviews.
Yeah.
I mean,
and understanding the concept. So if we go back, so yes, those are the things you want to consider mainly.
I guess.
But because people want to know some sort of passing rate, we have to kind of implement that system and understand.
Yeah.
Okay, what is the passing rate? So if you look at, you're saying if you take all the students that took the exam, that could be called like the general passing rate,
Yeah.
and usually that's something that institutes don't talk about.
Exactly. Nobody talks about. So you only see like the above 90%, right?
Yeah.
For every institute. So is it?
Which is
does
fair.
that mean that everyone taking the course, like 90% of those people are passing? No.
No, of course not.
No.
Because not everybody that takes the course is qualified to take the AFK exam.
Yeah, that's what people need to understand.
Exactly. So,
Exactly.
So when someone asks you let's say in a consult, and they go, "What's your passing rate?" What would be like your reaction to that? How would you answer that? I mean, you could answer it confidently, but you could.
Yeah, we're happy with the results from this cycle, so I confidently tell them the 93% because that's what they actually want to know. Like they don't want to know the general passing rate because they will compare that to what they heard about the other institutes.
Yes.
So yeah, and I feel confident that the way we calculate the passing rate is a fair way. Do you want to?
Yeah. So like
break it down, maybe.
We could break it down because each institute will have a criteria.
Yeah.
And this is what they call the adjusted passing rate, or some may call it that way. So it's like you take into consideration certain candidates and you calculate a passing rate off of that, right? Because it's fair to take into consideration how much did that student or training dentist prepare, use the course, maximize the potential. If you're, let's say, working full time and you can't get through the course,
it's not fair to consider that person in the passing rate.
Exactly, because we don't think you should take the exam.
Exactly.
So it's fair, but people kind of generalize. Some people want to know the general idea. And what we do is our criteria is based off the mock average, the evaluation test average. We have an evaluation test and a mock average. And if you met both criteria, for us, it was 100% of those passed.
Yeah, 100%.
100% of those people that met the criteria for both passed. Of course, we don't say it's 100% passing rate because we're trying to take a reasonable approach. We see the criteria for the evaluation test alone. That's where we have the 93% passing rate, right? But if you look at the general, what do you think? Like if you look at just everyone.
Even if you look at our general passing rate for this cycle, I think it's really good. Like it's a little above like 50%.
Yeah, take into consideration
It's
everyone.
really good.
Because
Yeah.
we what happened is, so we actually tell students, the people that are below this score, it's 50-50 for you. Like you
Yeah.
might not pass. So don't go unless you want to go take the risk, get the experience. It's your first attempt.
Yes.
Sure. But if you want our advice, that like when
you
you,
need
hit
to be
that
above a certain
a number.
score. Yeah, a certain
Exactly.
number. And
Yeah,
I do
so-
tell people that in the consults as well. I'm like, the passing rate is this. This is not a guaranteed pass, right? Like when you sign up for any course, no one will guarantee you a pass. We may have ways of supporting someone who didn't pass, but we can't guarantee a pass. But what I tell them is, at the end of the course, we're going to evaluate your performance
and studying of the
advise you,
course, like how well
and
you studied the
studying.
course itself.
and advise you if we think it's prudent or not for you to go to the exam. Right?
Yeah, and people that like failed from our cycle, even we followed up with them, and every case had some sort of, reason of why
Yeah.
they failed. We were able to analyze. Each person is different. You can't, put people in this like cookie cutter
yeah.
factory thing. Everybody. Some people were working full time. They couldn't do it. Some people had different circumstances. Some people were just like, studied but had an issue with, when they deal with new questions.
Yeah.
So we analyzed that, and we had like, we recommended something different for each person, put a
Yeah.
plan for them, right?
And also, we advise people, for example, you have around 50% chance of passing, and those people sometimes decide to just go for the exam. Just go for it.
If their first attempt.
So, like...
As long as your
We
expectation.
kind of knew
yeah,
that, some 50% of those people wouldn't pass.
Exactly. And
And
we told
still,
them that.
we had like a great,
Yeah.
great results. So.
Yeah, I'm proud of what we did last
Yeah.
cycle. So that was really
I
good.
know.
And
It was great teamwork.
Good. Thank you for. Yeah, it was great. I think we did a good thing, and we're hoping to achieve it, do better even this cycle. How was the midterm test? It was fun, right? Did you see when
that was so good. Just give me a minute. The live session we did
Yeah.
was really good for them to understand. Like when you're faced with a new format of questions, like what do you do and what happens? They saw exactly what's going to happen. Like, oh, I'm going to
Yeah.
get nervous, and I might not get easy questions right.
Yeah. So just in case people listening don't know what the midterm.
Oh,
so
yeah.
during our AFK cycle, we decided to have our AFK course.
Yeah.
Right after anesthesia, somewhere in middle point, we have a midterm test that tests students on pathology, pharma, and anesthesia.
yeah.
And usually at this phase, students, we expect them to get 75%, and
Yeah.
they
That would be a good
Yeah.
score, like around 70.
and
75.
some are below that, and we tell them honestly, hey, you're gonna have to improve on this, you're gonna have to improve on that, and it's still
Yeah.
early in their phase, but it was a fun experience doing the live session, given
and
like
explain and show it was very the practical example of
yes,
this is what could happen in the exam, right? Like you prepare with a certain type of question,
Yeah.
and it's the same question, but it comes out in a different format. You may get flustered, you may get nervous, and that may impact your performance, right?
exactly, like it's yes, and that's what happened. Like they saw it live, how they misinterpreted something or
Easy
overthinking the question, thought it was not even some of them couldn't even finish because they were reading the long form questions so much.
It was taking them so long to go through the questions, they
Yeah.
just gave up. Some of them were like, okay, I gave up. Like the question was so long, I just didn't even finish. It was like so much.
I mean, they're still in training. They're going to get
Yeah.
better and better. But we have that midterm test, and I think that was a good experience, and for them too to learn from. Yeah.
It's the second cycle we apply this midterm test too. So I think it really helps them. Like
Yeah.
halfway through the course, have a test like that. Just to, see like, wow.
Almost knocks them off like what they expect.
It's a little reality check.
Yes. Like, oh, I'm studying fine. I'm doing enough.
Yeah.
The thing is, whatever you get in like evaluation tests or midterm tests, like it could be good for other exams, like your level. Let's say you get like, you know, in the 80s in the or whatever. But the AFK is so competitive. The AFK exam is so competitive that even though you're at a good level, just you need to be better than that. You need to be like more than just good,
100%,
right?
yeah.
Like for example, someone that does well in these tests, let's assume the evaluation test they get 82 or something, right? And we tell them, well, you gotta get above 90. Okay, 80s are good, but for AFK one above 90, maybe you'd pass the INBDE with the 80s. You know,
Yes, that is true. That is true.
What
Facts.
you've done the INBDE?
I have.
Yes. So how was that experience for you?
I did the INBDE right after the AFK, so it was. I don't want to. It was easier.
It was easier.
It was easier. Yeah.
Would you say?
It was just.
Some people are going to think like
It was
what?
a different
I'm
level.
failing this exam.
No,
Is it-
like that's not it. The content is basically the same, but the questions are more direct.
Superficial, direct.
Yeah, more superficial.
Not
as
kind of
well.
like-
no tricks. You know, just like that's what they want to know. You know, like the classic symptoms. They're gonna throw it there. Like for Paget's, they're gonna go.
I
My
haven't done the
dentures no
INBDE
longer
yet.
fit. Oh,
I feel like
Paget's
if I do it, I would pass, but
you
I could
should
say that.
You should do it. You should take it. You
It's
should take it.
Well, you did the AFK course,
Yeah.
right, with scholars. Then you went to the INBDE. Did you
Exactly.
do any extra preparation there to?
Not extra preparation, but I did take like some online quizzes. I found the INBDE
US
boot camp.
based.
Yeah,
Yeah.
US based, just to see if the exam format was too different. And it was. So I was like, okay, let me just take a look at this. And I took those quizzes, but for like 2 weeks.
And then that's it. And you made
And then
it.
that's it.
So INBDE is a easy. You could say
After the AFK preparation, yes.
Yes.
So if you prepare, like if you do a course for AFK, if you're like good for AFK, you're great for INBDE.
Like AFK is the heavyweight. You're going for
Yes,
AFK.
yeah.
You would.
It's like you're over prepared for
Yes.
INBDE, so it's good. It's always good.
But
right?
if you're not preparing for AFK and you're going directly to INBDE, yes, you could fail.
oh, it's
Yeah,
yeah,
for
I think
sure.
it's
It's
difficult.
all an
Like it's a
exam.
difficult. It's 2 days of
Yeah.
exam, a lot of questions. The content is basically like virtually the same as the AFK. So it's 4 years of dentistry.
Yeah,
So you can't say that it's easy, but after preparing for the AFK,
it becomes kind of a piece
simpler.
of cake. Simpler.
Yeah.
More likely to pass. Right?
Yes.
And there's no scoring for
Like our students, everyone who passed the AFK and took the INBDE, they passed. Both, right?
it. Facts.
Facts. We can't deny facts. So yeah.
So far, everyone that took the AFK course with us and eventually took the INBDE, I never heard anyone that failed. Everybody passed. So
Yeah.
it is like objectively, you could classify it
Also,
simpler.
You can find more people who self-studied for INBDE and had good
And
results,
passed.
but you don't find people who self-studied for the AFK and passed.
Yeah, I mean, you could find
Except for you.
people. you could find people, but the people are not like. It's not a majority number.
Oh yeah,
Like, very
it's
rare.
very difficult to find someone.
These.
I only know you, honestly.
In the past, it used to be where like people would study the release questions,
and
for
that
the
was
AFK,
enough. Yeah, I heard that. That was
and they used to get
Easier
lucky.
in the past.
Yeah, because they used to repeat a lot of the released.
oh wow.
Right, but now it's the released are since the time they voided that exam and
Right.
during
Yeah, I
I
heard
think it was
about
during
that.
COVID times, so then they kind of refreshed the way they bring the questions. Or
Yeah, but it's still like the same questions in a different way, right?
yeah, for sure.
Right? The content is the same.
The content is the same. Maybe they a little bit at that point. We went through. It's interesting how we went all through all this change. Like the perio change happened.
Oh yeah.
During
So
that
yeah,
time,
some
and
changes
then
happen.
I think that was around 2020 when they started implementing.
It can make things more a little
Yeah.
more
And
confusing maybe.
they started implementing more of the rest though. But yeah, it was before, in the 2010 between that and 20 something, like in the teens area, like that time where it was like some people did the release and just passed. But and then it was still wasn't easy because you could get lucky. Like, you have to get lucky still.
Yeah.
But now, I don't know, it's really difficult.
Even for the
competition is high.
INBD. So maybe like back then, the level of the AFK and INBD was similar. You could say maybe.
Maybe.
Because
AFK,
INBD is not easy. It's not like easy.
Yeah, it's not
even if
like-
you self-study, like it's not going to be easy.
yeah. But if you take an AFK course,
It's going to be
Then it
very,
feels
very
easy.
unlikely
yeah.
to pass, to succeed, right?
Very unlikely.
Self-studying. For the AFK.
Okay.
Like if you self-study for the AFK, it's going to be very unlikely.
Yes. We had a survey actually, and I think it was 15% chance
15?
of passing. Yeah,
Wow,
if you did.
that sounds high.
Sounds
high, though.
But that was like there could be some margin of error because people may be replying to the survey could be only people that have taken a course.
And
So
then
to
they
find the
consider-
people that did not take any course and failed, it was harder to include those people in the sample, right? Because we just put it out there on social media and like fill up this form. If
Yeah.
you taken this was a while ago, can't remember exactly which year, but I could check that. But it was maybe in 2019 or 2019 probably. But we put that out there for okay. If you took this exam, we collected the data. From that, we got if you didn't take a course, 15% of them passed. I think it's probably realistically lower.
Yeah, I think
If
it's
you
lower.
find the people that actually didn't
Never took any course.
any
yeah.
preparation,
Yeah.
Taking a course is always better than taking no course. Doesn't matter which course. It's
Yeah,
like
100%.
at least taking a course is better than nothing.
Yeah,
And then which course you could do your research,
100%.
book consults. We do that here
Yeah.
too. Also, we have what happened like recently. The NDEB changed the that you could change the dates or something or the
location.
The location.
Yeah.
What was that
That's
update?
new. So apparently, you can change your location without having to withdraw from the exam and then fine for another seat. So without
before-
losing your seat, you can try and change your location.
Before you couldn't do this.
No.
It was only that you had to withdraw and re-register.
Yeah.
Okay,
So like
yeah,
it's
that's-
not always like it's a guarantee.
It almost seems like an obvious thing to have, but I guess it's not.
Yeah.
Like
why
but-
didn't we have this before?
I know, but I guess that's how it feels like. But seats are hard to get, so they're like, don't
I
do
guess,
that.
Yeah.
Did it work? Do you know anybody that actually used it?
I don't know. I tried to see if I could change my location because I got
For
Ottawa.
ACJ.
It's not too far though.
For
from,
ACJ,
from
you
me.
mean?
For
For ACJ,
ACJ,
yeah.
But it says that you can change locations for ACJ, AFK.
Yeah.
But I
good
couldn't
update.
find the option, so I don't know if it's going to be implemented later, or I just couldn't find the option because there are no seats available to
So
try
it's
and
hard
look
to
for
know
a different location.
what the
Yeah.
reason is, or is it actually? Yeah.
Yeah, that's like fairly new, right?
Yeah.
Yeah.
That's a good update. I mean, you can see that the NDB is trying to do stuff to make improvements.
Yeah.
Of course, it's going to take time and a little bit, to get to that everything people want. But I always see that
Yeah.
they are making improvements.
They
Like
are.
I know that in the NDECC, they're renovating their Ottawa Center to
Facility,
accommodate
yeah.
more seats, which there's also a seat problem in NDECC, right? People are not getting seats. So they're always trying to improve. I'm not sure how they, move forward with decisions, but I
so
see
for
always.
now, the NDECC exam is being postponed, I guess.
Yeah, I recall that the date, the registration opening, or the date for registration has been delayed for the next batch.
Right.
I'm not sure by the time this video is out if that changes, but at this time
Yeah.
it was delayed and they're doing renovation. They said that they wouldn't open it until they could guarantee for sure that they could accommodate, things are all set up properly.
Right.
So it causes delays, but it's hopefully, move in the direction of
true.
helping, students get seats,
Yeah.
right?
It must be frustrating though to not know, when
Yeah.
when are we going to be able to register? But yeah,
Especially when you're
it's
it's costly too to practice this
Yeah.
for the NDECC, right?
yeah,
And you don't know if you're getting
and
a
you want to
seat.
be sharp, so you want to be preparing, you want to be
Yeah.
ready, and then you don't know when.
I mean, people face that almost in AFK and ACJ a little bit, but
little,
not as you kind of know ahead of time enough, right? Whereas in NDECC,
Yeah.
it's they have to go maybe for a 3 or 6 months course, and they don't even know
If
what
they're getting the seats.
for any date. The dates
Yeah.
could be any time of the year, so they don't even know. Am I going to get the date after the course or 3 months from now, or So it is frustrating, and we're here to support the dentist, and hopefully they get sometimes for the best that they get a seat later too.
True.
How did you get your seat for AFK? How did that happen?
For AFK, mine. I wasn't approved for the NDEB. while I was doing the course. So I didn't even, I was actually hoping to get a seat for the August 2024. Yeah. So this year, yeah, I was hoping to get August 2024, but
which means, wait, just to
this
give
year.
kind of a perspective, August 2024.
My course started September.
After the exam you actually took. So you were hoping to get August 2024, which is the date after the exam you actually passed, which is in February.
Yes. Yeah.
Yeah.
Because my course, I took the course September 2023.
Yes.
It would finish. I would finish the course in February, and I was planning to self-study until August.
So you're planning like almost a year study.
A year, yeah, because I had been away from dentistry for a long time, so I just wanted to be safe and It's better.
It's fair,
right?
Yeah, of course.
To be over prepared than under.
Yeah.
Also, I didn't have my NDEB approval, so I was like, I'll just wait. I'll just study more. Like it'll give me more time. But then I got approved in this December. It was close to the registration.
Deadline.
Yeah, to the
okay,
deadline.
so it was really close call for you.
It was.
Because you also probably receive this question a lot, and we receive it if you're not approved, what do you do? Do you start preparing? So you started preparing.
Yeah, I did, yeah.
And you were hoping anyway to go for the next year cycle, and then you got approved in December.
So I got approved in December, and I found a seat easily. There were seats. I found a seat in Ottawa again. Ottawa. Yeah,
it's quite a drive still, but
it
still
is.
in Ontario.
But it was a fun train ride.
Yeah,
it was nice. I was
drive
studying the whole
yeah.
time. It was.
So it gives
nice.
people hope to know, even if they're in our batch now, that if you're not approved or you don't have a seat,
you may still find it. Yeah,
exactly. Because not only you weren't approved at that point, you got approved and you found a seat all at once.
True.
And
you
passed the exam.
And I passed.
You passed the exam. And you passed the INBDE.
I didn't need the extra 6 months that I thought I would need.
Yeah.
So that's also something that people need to understand, that sometimes we have a misperception of our knowledge and how much we know, or how long it's going to take us to refresh our memories, or be ready. Because I didn't even think going to the exam, I didn't think I was ready.
I think that's a common feeling, right?
Yeah, I think,
especially in AFK.
does anyone feel ready?
You feel, because there's so much knowledge, you always feel like you could do more.
Yeah,
As dentists, we're overachievers. We want to perfect things. We want to do more. We feel like there's still more to do.
Exactly. And even after the self-evaluations, I was above 90. I didn't feel ready. I don't feel ready. And we've seen people last cycle as well, being super worried. They're scoring 95. We're okay, you're in a good.
Go for it.
Yeah, go for it. Go for it.
And
but
most
they
of them
were
passed.
not feeling ready. They passed. So we have this misperception, and I guess it's about confidence as well. But once you get there, and if you're not too nervous, things might happen. Things might surprise you.
It changes from person to person. So some people could utilize 6 months, but they're really good exam takers. Some people could, they study it well. When you talk to them, they know the knowledge, but they're not good at taking the exam, right? They get stressed.
100%.
There's some cloudiness that happens during the exam. So there's, maybe I could say
anxiety.
It's safe to say you're a good exam taker. You like exams.
I do.
You like exams. So
I do. I like exams.
You're a good exam taker, I would say. If you like exams, I feel like that helps, right? Do you feel stressed when you were in the AFK exam? Was it stressful?
I didn't. But that's unlike me. I don't know.
Yeah.
I don't know what happened.
You said it was close.
I didn't
you felt
I think I know what
prepared.
happened.
Yeah.
I didn't feel ready, right? Like I said just now, I didn't feel ready for the exam, and I thought I would need the extra 6 months. I just took the seat for February because I thought, you know what, it's going to be my first attempt. Let's just go for it. So I went for it, not expecting to pass. So I didn't put any pressure on myself. It was just let's see how.
I'm just going to go and maybe fail this exam.
Yeah, let's see what it feels like. Let's do it. And it just felt like another mock.
Another mock. And then.
So I was calm.
I think that's what helps people pass, is being that calmness. Because
not putting pressure on yourself. I need to pass. Oh my gosh, I just finished the course. I need to pass. People who do this,
it
they're
makes
going to be too stressed.
Harder to find the answers in the exam because they're thinking about that.
Yeah.
And the fear
of
that
in the
and
back
the
of
consequences.
Your mind. 100%.
Yeah, it's interesting how it's when you could just calm yourself down, how much boost of a chance you could get from that.
Yeah, clarity, you know, when you're not worried, when you don't have that in the back of your mind, it's just like you see things clearer.
Yeah,
Like,
the question
you know,
becomes like you unmask the question.
exactly.
And you could see that, oh, this is just something I studied. Whereas other people that are stressed will be like, this question I don't know. But if you talk to them, you could say, no, that is something you know. You just have to not let the question trick you with the wording and the different phrasing.
Just like what we talked about in the midterm test. It was the same questions. Like the questions are there, like the knowledge, the concepts are there, just disguised. You need to decode the questions. And if you're nervous, if you get nervous, you're not going to be able to do it.
Exactly.
Right?
Yeah. So the midterm test, like we
yeah.
counted around 74 or 75 that we know are in the book, are in the courses. Just the question looks misleading.
Disguised.
Exactly. This guy masked. Like it has like mask on it, right? And they think it's a whole different thing.
Yeah.
And that's like we could call that how confident are you with the knowledge you have? Like
With the
assume
concepts,
you know
like how
the answer.
strong, like how much have you mastered these concepts?
Well, wait, I think those are two different. Like you could master the concept, but and then believe you have all the concepts necessary to answer the question. If you start doubting that you have it, you stop kind of looking for the answer. You know what I mean?
I see. Yeah, I see what you mean. So you're saying something like more about like your confidence, like
Yes, assuming
how much
you
you
have,
trust yourself.
Yes, assuming you have the knowledge to solve the question. If you look at a question and you go like, this looks like a whole new thing I haven't seen before, it's almost like you gave up. But if you kind of, they're good at making questions look like they're something else other than what you know. This is how so if you assume you know it, it's always safer
Yeah.
to get the
I
question
agree,
right.
yeah.
You know?
That's one of the advices we gave people after the midterm test, and we showed them. Like, look, this question, for example.
We put people on the spot a little. Volunteer.
But it's good, and not like just to make them see that they know this. You knew this, right? You knew this, and if they didn't, then it's like, this is what you need to review, right?
Exactly. Yeah, my experience
important.
with the AFK, I remember like when I applied, I was hoping to get it back then it was once a year. So I was hoping to get the 2012, but because I wasn't approved yet, I couldn't get the 2012. So I ended up doing the 2013 and I had a whole year to prepare. So I started preparing for a year from the dental decks mainly.
Wait, but you wanted to like get your seat before you started preparing? Is that how it
Back then there wasn't a lot of information out there about like this. There's no Dr. Hafez on YouTube telling people what to do. So I was just kind of like, well, you know, just like anybody coming in, I did the self-assessment. I got, I think, 72. So I was like, oh, you know, I could probably handle it, you know.
But you had just gone out, like you had just finished dental school, though,
yes,
right?
from Syria. So it was still, I was just going in to see what's going to happen. But one of my documents needed adjustments and I missed the date. I even called them. I thought, you know, I'll see if I could talk to them. But now I understand how strict it is. So
it's not like that.
Like, come on, just make it happen. So I resubmitted the documents. I got it approved. But I'm like, okay, maybe it's for the best. And then after studying for like a year of I realized how easy it is to forget things. I studied from the dental decks, started writing things down. I noticed that the first read, I just ended up writing everything in the dental decks on just my binder. just
copying.
Just copying. Yeah, that's what happened. Because everything seemed pretty important, you know?
Yeah, everything seems new. Like, oh, okay, I need to know this. Like, you're basically just copying the whole thing.
Did you ever use dental decks?
I had the dental decks at home, and I did use them at the end of the course just to quiz myself.
Yeah.
They were basically almost the same as the release questions we go through in the course, but since I had scribbled all over my booklets, I was like, okay, let's just use the cards. It's easier. But I tried to, read the back, like just, you get the answer at the back, right?
Yeah.
So
there's like sometimes an
it's so
overdone
confusing
explanation.
Though. Yes. It's so confusing and there's no flow. Like there's not a sequence of,
Yeah, like
the
here's this
not
thing.
in a sequence.
That you
here's
just
this. It's all thrown.
Here's a bunch of information.
Yeah.
By the way, a note about this other thing.
Yeah. By the way, there's this other thing you need to know. It's not really related to this, but take notes.
Yeah. When I studied the decks,
so confusing. I didn't. Really
I crossed out on the decks and I labeled the cards. And sometimes I think I showed you some of the decks, like the cards, how I scribbled them. And labeling them because there's repetition too. Like sometimes you have,
Yeah.
you know, a cyst here, the same cyst is talked about in
With
a
a
different
different
card.
question, yeah.
Yeah, but so you use them after you felt like you mastered well, maybe you didn't master the content, or did you master the content, you felt?
I didn't feel like I had mastered the content, but I was confident with what I had, you know, studied. And towards the end, during the mocks, I was like reviewing a lot. And then I just wanted, you know, to test if I had, you know, for example, if I was reviewing that day endo, then I wanted to test myself, like to quiz myself on
So you
that.
go check
I'd
out,
get like
yeah.
the endo decks and just go through the.
Did you end up
cards.
crossing out like I usually recommend, or were you
In
not
our
able to get
booklets?
to that? Well, wherever you were able to cross
Mostly
out.
for pharma and pathology, which I was reviewing more throughout the course. But then it was just like so scribbled, like, you know, it started to annoy me.
The crossing
My
out.
booklets, yeah,
Oh,
the crossing
yeah.
out. I'm like crossing out
You
things. I'm
couldn't-
like, no.
What about
That gets
questions?
overwhelming. No, the questions, not the book. The book I
Okay,
didn't
you never
cross
touched
out.
it. You don't want to cross out the book.
No,
It's just- yeah, yeah.
no. The books like,
Preserved.
remained pretty. Yeah, like just some notes, you know, highlighting.
They're nice covers.
Yeah. Now I have my new books with
Yeah.
the new cover. But yeah, like I try to keep the books neat and tidy. Unlike other people. I'm just kidding. Unlike your decks.
Something about them being scribbled on makes me feel like I've been
Like
through it, you know?
Okay,
Like,
yeah, no, I get it.
I go back to it and I go like, okay, I've been here before. Why am I not remembering it? So I should be, it's kind of evidence how much, you know, but
yeah. I
doesn't
saw
bother me
them.
that
I'm like,
much.
oh yeah, he really went through these decks. But to me, can you see how? Like, can you?
Yeah, of course.
Like
The
if you look
neatness-
at one thing that's like all scribbled over, it's like, oh wow, like I don't even want to look at this. I don't know. For me, that's how it feels like.
yeah, everybody has a different
Yeah,
like, approach. but-
exactly, like a strategy, I guess. And yeah, so I use the decks just to quiz myself.
Is there specific subjects that you use in the decks, or maybe you focus on a specific one or not?
In
Just
the decks?
random.
No,
Yeah.
it was confusing.
Okay, so you prefer, obviously the
Yeah, the
yeah,
book.
well, just
the
for fun
lecture.
kind of thing. You're just changing.
Yes.
Yeah.
Yeah.
Did you use them for INBDE or no need for INBDE
No.
to use them? Okay.
No, just the online boot camp
Boot camp on top of the AFK course stuff.
after the course. Yeah.
Okay. Well, that's good I think that's good for people to also learn,
Yeah.
like from our experiences and your experience.
Mm-hmm.
In terms of, we talked about the AFK results came out, the passing
Mm-hmm.
rates. Also, I'm not sure, you're not in it yet, but the index also results came out, I think, last week or 2 weeks ago, but we had a good passing rate, specifically in
It was
skills.
2 weeks ago.
Yeah, 2 weeks ago.
ago.
Where, we had and now we
Good.
have an event. You know, there's an event going on this
Yes.
next door,
Yeah. It's
where people are coming in, just doing work checks.
work
and
checks. Yeah.
There's a
that must be
contest.
good.
So
Yeah,
we're playing,
there-
where we have a contest. Now we
Someone's
extended the
gonna
contest
win.
for next week.
Oh yeah. Oh good. Okay.
Well, some
Someone's
people
gonna win
came
a
and didn't bring their
notebook, so-
instruments, and their contest requires them to prepare a tooth on site
Right.
so that people don't cheat.
So you changed just the contest. They're coming back just to do the contest.
Yes.
Okay.
Because they didn't have their instruments, so we're like, okay, come back next week.
You can prepare.
we'll-
Get
we'll
another
prepare.
check, so they get 2 work checks then.
Okay, sure.
Right?
You said it now. We'll do it. No problem.
Okay, so 2 work checks. Yeah, that's valuable.
Yeah. And so they'll participate, and then there'll be a prize, like whoever gets the best work check, right? So that's happening too there.
Fun.
That's part
Yeah,
of
sounds
what-
fun.
when you pass the ACJ, sorry, the AFK.
No, yeah, I
the
didn't.
AFK. When you pass the AFK,
Not
I remember
there
you
yet.
telling me that you wish you kind of started the ACJ.
Oh yes.
So that's an
Are we
experience
changing
point.
topic?
I am jumping to another topic.
Okay,
I'm
go.
switching off
Let's
the
go.
PLA.
Yeah, PLA. No.
I'm like, we'll talk about that another time.
Yeah. We can talk it after I either
Yeah.
pass or not. Okay.
So right now you're in the ACJ course for the first
Yes.
time, right? And I tell students like take the ACJ right after your AFK
That's a great advice.
because you're
People
not.
should listen to you. Honestly, they should.
They're gonna be like, really? Okay.
No, it is true though. I'll
The-
explain.
They won't
No, you
believe until they
finish.
see
Yeah,
it.
I'm not
Yeah,
gonna-
go ahead.
No, you go ahead. You finish.
Okay, so I'm just saying that the reason is like when you pass
Mm.
or if you end up passing, it's like the results come after 2 months after, and
What are you gonna do with those
you just
2
have
months?
to wait so much for the next ACJ, right? So, and we give a free repeat.
So there's
So to tell people
downside. What's the downside?
Talk
of
about why
starting?
you think
Right.
you should have listened.
I'll break it down
Okay.
to you guys. It's because I felt like after the AFK, I felt like I needed a purpose. I needed something. You get so used to a routine of like studying, and then all of a sudden you don't have to do that. So it's kind of like you feel lost a little. And so I was looking for something to do with my time. Like I didn't want to stop studying and then, lose that rhythm. But I thought the ACJ would be like another like super heavy, course, like heavy
10
content, 10 books, and it. And
Wait,
it's
AFK
not.
is 4 books, just to make sure.
AFK is 4 books.
Not
Yeah.
10.
Let's not confuse people.
Yeah.
But so I thought it was going to be like just heavy, and I had just finished the AFK. I'm like, okay, I know I need a rest. Like I should rest. Like I should take, some weeks off. But my brain didn't want to do that. So I kept looking for something to study, which is why I ended up like taking the INBDE.
So you went for the INBDE because
like
you're not,
I wanted to use the knowledge that I acquired on the
take the
AFK
exam.
course. And
but you're not seriously considering a
No.
university in the
Well,
US.
At the time I would have considered. Now I'm not. But also I just wanted to see like how it would go, right? Like I didn't know if I had passed on the AFK. Yeah, but I was like, let's just see how this goes.
Yeah.
And it was, and as you know, like I like taking tests. I'm a good test taker.
Yeah.
So I went to the exam very happily. And
Very happily.
yeah, very happy.
Yeah.
And so, yeah, but I still wanted to like start studying, but the ACJ seemed like it would have been too much. I should have informed myself better because it's only 1 book. So it wasn't like, it's not that.
Asked,
Yeah, but
got some information.
but it was like everything happens for a reason.
Yeah, it worked out.
It worked out. I started
did some-
working for scholars. So
Yeah, you
it's
did
really
some
good.
projects. You
And I
worked on the
ended up
mocks.
studying.
That's good.
Yeah. But yeah, so if you guys finish the AFK, I think they should listen to you.
Go for the ACJ right
Go
away.
for the
Don't waste
ACJ. Like
time.
it's lighter. It's just like
It's ACJ is an interesting.
it's different. Yeah.
You could enjoy studying ACJ,
Yes.
right? That's
It is
part of
very enjoyable. It's fun. I mean, like if people like pharma, pathology, radiology, those things, it's
Well, you get to look
it's
at
very
pictures,
fun. Yeah, you
try
look
to
at pictures,
recognize these things, yeah.
radiographs. The sessions are fun. I like it. I am enjoying it, and I wish I had taken it sooner. But yeah, and like you said, like if you end up not passing, if people end up not passing the AFK, they can repeat the ACJ later on. And you're still like going through like material that can be used for, let's say they have to go for the AFK again.
Yes.
You're still studying,
Yeah,
pathology.
that's because
you know,
there's some things in the ACJ that you get, let's say, stronger in. It almost like in ACJ you drop certain things, but you really focus in depth on certain things. So you
Yeah.
get way better in pathology. You'll get better in perio,
which
right?
is good for AFK
And
as well, right?
You could that's transferable to AFK.
Exactly,
Yeah.
yeah.
It's not repeating everything. You're not taking like foundations of radiology or
No.
some theoretical, but it'll certainly make certain parts of AFK easier. So it's never, it's never a loss to
No.
study. Even if you failed the AFK,
And have to go back, yeah.
it's going to help, right? I want to circle back to the INBDE and just go like understand the exam. Do you remember the exam structure?
Yeah, it was like there's images, so not like unlike the AFK where it's just text. The INBDE, there's images, there's
some
radiographs,
cases.
there's like patient like cases. So like
Still one
kinda
answer
like
though. Only one answer.
one answer
Yeah.
though, but it's kind of like what the ACJ, like an ACJ question would look like, but with one correct answer.
5 options.
Exactly.
Whereas ACJ could be 15
Multiple,
options.
yeah.
and multiple, correct. Yeah.
So yeah, and also I think it makes it easier when you look at images, right? So think about the AFK. Like it's really hard for pathology,
Yeah.
for example. Like you have to memorize, how each lesion, like each condition looks
It's like how they're
like
described.
looks like
Lesion-
not looks like, but how they're described.
How described to text.
Yeah.
That could be like dual, like, because if there's a keyword you're looking for, then it makes it
True.
easier.
Yeah.
But because sometimes the image, if they bring you a confusing image, but also if they
On
bring
ACJ, you mean?
Huh?
On ACJ or INBDE, or it doesn't matter.
Just in general, like if they bring you an image and the image is not clear,
Right.
then it makes and they don't bring any supporting text with it. It could make it more difficult.
Right. But no, like for INBDE, for example,
They're a
there's
classic.
image and some
text.
description. And text and some
What did
description.
you drop?
My phone. It's fine.
It's okay.
There's a
It'll
case.
survive. Yeah.
It will survive, yeah. It's used to it. But yeah, so there's image and text. So like,
for
doesn't
example,
that make it easier?
They bring like a linea alba. Sorry, not linea alba. Let's talk
That's-
about
yeah.
leukodema. There'll be an image, and then
They're
they'll
gonna
tell
say,
you that
oh, when
disappears
you
upon
stretch.
stretch.
Yeah.
Yeah, that's
So like, how can you get that wrong?
INBDE.
After you put it, so easy.
INBDE is
No,
yeah,
it's
seems
not.
like
It's not easy. It's just
It's easy after AFK.
after AFK, 100%. Yeah.
Yeah. I think that's good information so far
Yeah.
that people could use.
And you should take the INBD.
Is it a challenge? Like
It is a challenge. I'm challenging you. You should. No, you should.
when I get some time, I just
You know,
right
like-
now I'm so busy. But
Don't you like taking tests? I feel like you do.
I enjoy. But
Right?
one day if we get 100,000 subscribers,
100,000. No, let's get like 1,000 likes.
you have to sign a petition. Like
No,
take
1,000
INBDE.
likes.
1,000
Dr.
likes.
Hafez must take the INBD.
Oh my God! After yeah,
It's fair.
it's a time
fair
thing.
though.
I mean, I think it'll be fine.
I think so.
I'm pretty sure. Yeah, I could pass. I'm passing pretty. I did one of the implant tests too, like for the AAID, and like I find myself being a good test taker these days. So,
These days. Oh, it was recent?
I took it a few years back. But
Okay.
Back in school, I used to take the tests a little bit, overthink questions, and when I was in dental school, and then when I discovered this strategy of like, okay, I'm gonna, dedicate
Assume I know.
40 minutes, 50
Oh.
questions in 40 minutes, circle the questions I don't
strategy.
like, moving. Yes.
Yeah, you should talk more about this. This is good like advice to give.
Yeah.
people
So
in
like
general.
what I found to be useful is I try to get through 50 questions in 40 minutes. Whether I answer the question or not, that's fine. Like I don't have to answer every question, but I go through them. So when I'm at question 50, I want to look at the clock and I want to see that 40 minutes have passed. So I kind of check how I'm doing. Like if I'm at question 25 and it's 15 minutes, that means I'm ahead.
You're good, yeah.
So I could think a little bit more if I want to. But if I'm at question 25 and it's 30 minutes, then I'm behind.
speed
So I
up
need
a
to speed
little.
up,
Yeah.
which means I have to leave behind more questions. I'll circle and move on and not answer the question if I don't like that question. If I find it to be
I don't
for
like
sure.
the
Yeah. If I look at a question and it's like, this question is irritating. It's too annoying. It looks, I need to think about it. I'm going to
Yeah.
circle it and move on. As long as I get to 50, somehow when I get to the end of the test, there's always a lot of time left when I do the strategy. And the questions I left behind always end up being a lot less than I thought. Like I thought maybe I left so many questions, but I go back and it's like, oh, maybe like
This wasn't, why did I leave this one behind?
some
Right?
are like that, and
Yeah.
some are like I just realized that it's a lot less questions or fewer questions than I actually thought I left. Right? Maybe it was ended up being, 10 to 20%, or, but yeah, that's what helped me, and I used it in multiple exams and always been working. So that's what we teach here. I don't know. Did you use that technique in the exam?
Yeah,
It
we
work
did.
for you?
Yes.
No, it doesn't work
did.
for everybody.
No, it did. I think it does work for everybody. If
Does it?
they're actually using it, because look,
Yeah.
it only makes sense if some question is making you nervous or like, oh, I need to think more about this. If you need to think more about a question, it will make you nervous because you might not find your answer right away. You're going to waste a little bit more time.
Yeah.
Then you're going to feel like you're late. Everything
Yes.
like snowballs into you getting nervous, and that will impact
The next.
how you answer the subsequent question.
Yeah, because if you're nervous now and you're
Yeah.
like, you might get to a question that's considered easy and answer it incorrectly.
Yes.
Or might not
Or
even
lose-
get to that easy question.
Exactly. Like if you waste your time on one question, you get to the end, you have to like rush through, let's say 10 questions. What if like all those 10 were easy questions, or 8 of those were easy questions? You wasted your time thinking about one difficult question, and then you just have to
Yes.
rush through easy questions.
Yeah.
It works for everyone.
It works for everyone.
If
They're not using it
that's-
right.
Yeah, they are just not using it right. Or,
Or
they're not using. They
they're
say
not
they
using
did,
it.
but they didn't.
Or maybe they're like mentally they can't get to themselves to that point. Some people
to
just
skip
can't do
a
it.
question. Yeah, exactly.
Some people just go like, I can't
I can't
I keep
leave this
thinking
one
about
behind.
it while I'm here.
Yes.
I give people the example during the midterm live. Remember, I'm like,
Yeah.
well, if you're treating a patient right now, you can't be thinking about the other patient.
The previous patient, yeah. What do I do with that patient?
You
No,
got to be
have
able to
focus,
mentally, you know,
focus on what you're
doing at the
doing,
moment. Yeah, it's good mental, you know, skill to have, right? Like you have to be able to
It's
block
an
out.
essential.
Essential.
It's essential
For a doctor, for a dentist,
Yeah.
you know, you
for
gotta
test
be able
takers.
to, for test
everything.
takers.
Yeah, it is surely. Yeah.
It works for everybody.
That's something that works for everybody.
So
yeah.
that test,
Yeah,
the
test
the
takers,
strategy,
dentists.
they're just not using it right or something.
I think so. That's what I think.
All right, so good conversation. I think that was
Yeah.
beneficial. You want to go check
Yeah,
out the
let's go.
event? See
Let's
what's going
go.
on?
Yeah, let's
All
go.
right.